It's Thursday, January 28th, and the time for your Barbados Today morning news update. Government's pending 2-week lockdown of the country aimed at combating the spread of the COVID-19 pandemic has not gone down well with a key spokesman of the private sector. This despite getting the full backing of the trade union movement and key political players. Emmanuel Joseph picks up that story.
On Tuesday night, Prime Minister Mayor Motley outlined several restrictions that will take effect from February the 3rd, which are aimed at negating the threat of COVID-19 and bringing community spread of the viral illness under control. However, Edward Clark, who is chairman of the Barbados Private Sector Association, is not at all happy with the lockdown.
I don't think a lockdown was necessary, but we will support it. The business sector will support the government in its decision, and we continue to work with government and the officials to try and ensure this virus doesn't spread any further.
But the main public sector trade union is fully behind the lockdown. Acting General Secretary of the National Union of Public Workers, Wayne Warren, told Barbados Today the action was necessary.
The NUPW support is guided by the professionals, and we support we support the action taken because it would be informed through a collaborative process. The process, and it's something that even though it's a difficult situation, we the NUPW see the necessity guided by the professionals in collaborative process with all stakeholders that it is an action that, is a necessary action to help arrest the situation with the spread of the pandemic.
The umbrella trade union body, the Congress of Trade Unions and Staff Associations of Barbados, C2SAB, is also backing the shutdown. General Secretary Dennis DePisa told Barbados Today, while it was an unfortunate situation, C2SAB is in sync with the decision of government and the social partnership. When contacted, the Barbados Workers Union was not in a position to comment at the time. And for the general medical profession, the lockdown is a must, according to President of the Barbados Association of Medical Practitioners, Dr. Linda Williams.
We are where we are now, and we have to act now. We have to take steps now. And I know that a lot of people are still not on board or not understanding why we are moving to lockdown. But we have to, because if we have greater transmission of a more transmissible variant here, then it will mean to greater burden, not just for COVID-19, but remember we are also suffering from dengue right now, increased numbers of dengue cases and increased deaths from dengue. And we're also looking at the fact that we have a high non-communicable disease burden.
And the two main political players agree that the lockdown was long overdue. Opposition leader Bishop Joseph Atherley said he had been asking for it for a while now.
Well, the lockdown is something I've been calling for a while. It should really have come much earlier in the month when we saw that there was that sudden spike in the cases, the positive cases of COVID. I called for it since then. I think the country needed the time to pause, to give the system time to breathe and the people within the system time to be able to catch up with the obvious spread out there. So I support very much the lockdown. It's not for a long period at this stage, and hopefully it gives governments, people on the ground, the opportunity to do the community testing, the contact tracing, so we can get a handle back on this thing.
Meanwhile, President of the Democratic Labour Party, Verla DePisa, said in a statement that her party had been advocating for a lockdown since December last year, aimed at allowing the health care providers, other frontline workers, and the country generally to breathe. Emmanuel Joseph for Barbados Today.
Some village shop owners have made an appeal for government to shelve plans to close their operations for 2 weeks starting next Wednesday in a bid to get a handle on the COVID-19 situation in the country. Those who spoke to Barbados Today insist that there was no harm done during the first lockdown back in March 2020 when village shops were allowed to function. Here's what some had to say.
Thanks is that you shut in the small shop and open a supermarket. That's what you tell the public now to go and bundle in the supermarket. But don't care what you do. We just got a tendency when they hear something is on this bundle. And I feel that the fact is that we were never in a crisis where food was short or anything. There's no fear of that. Anything to hear, even to hear like anything happening, the first thing is bound, everybody's bound to the supermarket.
During the few months, things were really trying for me, and to have my little small business now closed, it would really affect me, because, we all needed some finances, and in order to have the finances, we need to have products being sold. And if products aren't being sold, I don't stand anywhere. So, I find it really harsh. At least I believe we should have been given, the same time as the largest stores to have our businesses open. That's something that we deserve to have happen.
The Queen Elizabeth Hospital is fully equipped with an adequate supply of personal protective equipment, despite suggestions to the contrary. In fact, Deputy Director of Financial Services, Procurement and Budgeting, Stephanie Jackson, tells Barbados Today that the department has moved from the previously mandated 12-week supply of PPE to a 6-month supply, and she's currently engaging the hospital's suppliers in discussions regarding sourcing additional equipment.
There's no shortage of PPE supply at the QEH, and as I said, we're in constant communication and dialogue with our partners, with our suppliers. They've recognized that they need to assist us in this effort, and we are all on board. Like I said, we have a meeting this morning, right after we finish here, to ensure that we have our contingencies in place and to be assured of their ability to continually supply us. But as it stands right now, we do not have a shortage of PPE. So we have adequate supplies of PPE. I actually just walked the warehouse this morning just to be sure that we have the appropriate amounts. So we were previously mandated to have 12-week supply of PPE. And we were able to adhere to that mandate. Now the request has been increased.
Barbados and its regional neighbors are being warned to be on guard for bogus vaccines in circulation that could adversely affect lives. Executive Director of the Trinidad and Tobago-based Caribbean Public Health Agency, Dr. Joy St. John, is advising authorities to pay strict attention to the regulatory aspects of the distribution of bona fide vaccines to their populations. More in this report from Emmanuel Joseph.
In an interview with Barbados Today, Dr. St. John said while the sale of bogus vaccines may be lucrative for those selling them, it would have serious repercussions for the patients. She also identified the need for a proper regulatory system for the distribution of the vaccine as another area of concern.
I do not want bogus vaccine in the Caribbean. Already we know that there have been attempts to circulate bogus vaccine. We know that. Mm-hmm. So I do not want anyone getting their hands on something that purports to be, but is not. It's big money for who sold you, but it is an investment loss and, lives affected because they did not get the vaccine. So I would not want that happening in the Caribbean.
Dr. St. John, who once managed this country's expanded adult immunization program, is also calling on Barbados and other countries in the rest of the region to have their systems ready, particularly with regard to the proper storage of the vaccine.
I would want to see these vaccine services re-engineered to take into account the type of vaccine, because, we have vaccines that you have to store at -75. That is not your home fridge. Mm-hmm. So you need to have certain infrastructure in place to store. You need to have dry ice to take those kinds of vaccines around and maintain the cold chain and so on and so forth.
Executive Director of the Caribbean Public Health Agency, Dr. Joy St. John. I'm Emmanuel Joseph for Barbados Today.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To news from the region now, the recent spike in COVID-19 cases in St. Lucia is reportedly putting a strain on the island's healthcare system. More in this DBS News report.
The Ministry of Health established a link between persons not adhering to home quarantine rules and the sharp increase in COVID-19 cases. Health officials noted that in December, when the spike in cases became apparent, more persons were in home quarantine. Chief Medical Officer Dr. Sharon Belma-George says the upsurge in cases has affected the ministry's capacity to manage the coronavirus, forcing the quick implementation of new measures. During 1 week, staff at the healthcare facilities were greatly outnumbered by the number of persons coming for testing, forcing the tourism sector to employ private physicians to take samples in order to minimize the amount of hotel staff and visitors converging on the healthcare facilities.
And we did have a week where the numbers were more than the staff could manage during that period. And as soon as we were alerted, we got the authority to increase the number of physicians and nurses to try to manage, and also to change some of the policies that occurred to reduce the numbers.
And finally, on the international front, U.S. President Joe Biden on Wednesday signed a series of executive actions aimed at combating climate change. More from Reuters TV.
We desperately need a unified national response to the climate crisis.
Making climate change a top priority, U.S. President Joe Biden signed a raft of executive orders Wednesday, clean energy policies he promised would be a boon to the U.S. economy and an engine for job growth.
This is a case where conscience and convenience cross paths, where dealing with this existential threat to the planet and increasing our economic growth and prosperity are one and the same.
Biden said millions of good-paying union jobs would be created in wind and solar energy, something former Secretary of State John Kerry, in his new role as U.S. climate envoy, noted at a press briefing earlier in the day.
You look at the consequences of black lung for a miner, for instance, and measure that against the fastest growing job in the United States before COVID was solar power technician. The same people can do those jobs.
Meanwhile, Biden's nominee for Energy Secretary Jennifer Granholm, who spent 8 years as governor of Michigan, the hub of U.S. auto manufacturing, defended the administration's position in her confirmation hearing Wednesday as a way to prevent foreign countries from hijacking U.S. jobs.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.